Let me take you back to 1973. I was a major in the United States Army Medical Corps in charge of Nixon's Showcase Drug and Alcohol Program at Fort Sam Houston. 1973 was right before Vietnam ended in 1975. We never lacked, tragically, for people to fill our drug and alcohol beds. And all of them had what we would now call PTSD, but it had no name in 1973. It didn't get its formal name till 1980. It had names, but all of those names denoted cowardice or denoted character flaws or problems, and nobody wanted to have those anyhow. And I did what I was supposed to do, I thought, at that time for these veterans. Let me back up. I wasn't the strackest of all soldiers when I came into the Army. I had met the commanding general, General Boyson, and we became good friends. I bought my uniform at the thrift shop. And one day I had to go to a kind of dress-up deal with the general and others, and my hem came out of my pants. And I didn't have time to fix it, so I stapled it up together. And there I am standing next to the general, and the general looks down, looks over at me, and he said, "Croft, don't get dressed up anymore." I wasn't the strackest of all soldiers, but I did care about those patients in our drug and alcohol beds. But we didn't know what to do for them then, so I did what I was told to do, and that is to tell them stuff that made not much difference. I told them, stop being angry all the time. Stop smoking all that dope. Stop smoking heroin. Stop drinking so much. Get a family. Get friends. Get a job. Get a grip. Get a life. And I knew that wasn't the right thing. I knew it, and they knew it wasn't very helpful. But more importantly, they thought, not only does this guy not understand, he doesn't really care about us. But I did care. 14 years ago, I got the chance to start performing examinations, evaluations for disability. I'm a contractor for a company that works for the VA. As you've heard, I've now seen 7,000 vets over that period of time. And because I was so interested in PTSD, not only did I gather the information needed for the exam report, but I also listened to these vets. And for the first time, many of them opened up to me about their symptoms and what they had been through and what they had been going through for the last 35 or 40 years. And as a result of that, we started writing a little manuscript. We gave it to people, and they said, "How did you know us?" And I said, "I don't know you, but I know PTSD, and the symptoms are what I write about." And they thought it was so valuable that I found a co-author, Chris Parker, who's a chaplain who spent a month in Iraq, who's a trauma specialist, and we wrote the book. I always sit with my back to the wall using the Recover method for PTSD. And this is the Recover method. I'll just very briefly show it to you. R is recognizing when PTSD is in your life. E is educating yourself about PTSD. C is connecting your biology with your psychology. O is organizing a comprehensive treatment plan. V is viewing your issues in a new life. E is empowering yourself through a support system. And the final R is redefining the meaning of your life, post-traumatic growth. We'll talk a little bit about these as we go along. So why should civilian physicians care? Because PTSD is pretty common in the civilian community. The data shows about 10% maybe. Most of it from rape, incest, car wrecks, explosions, floods, fires, assaults, and the like. Amongst combat veterans, the RAND Corporation says that approximately 20%, 1 out of 5, come back from combat suffering from PTSD. That 5 million includes those from Vietnam, about 3.5 million who served there. and about 1.5 million who have served in the Middle East and other places, Bosnia, as well as other places. But what about the VA? Aren't they supposed to treat that kind of stuff? Don't they take care of veterans? Well, yeah, they do. But trust me, they're so overwhelmed right now that it often takes a long time for people to get in. So instead, they come to our offices. Some people are not eligible. I called my good friend at the VA and I said, "Who's eligible?" And he tried to explain, well, most everybody's eligible if they've been in combat. He said, "Go to the VA website and look it up." I'm a physician. Hell, I couldn't understand what they said on the website, and trust me, most veterans don't either. Some have no desire to go. Many went right after Vietnam and were told, "Look, we don't take care of the likes of you. We take care of sick people." And they swore never to go back again. Things have changed, thankfully, since then. There's word of mouth that they hear from other veterans that keeps them away. And it may be finances. You actually have to pay for VA care unless you meet certain criteria. And oftentimes, it's a matter of not being able to get appointments when you can get off from work or whatever. Or one of the common complaints is the staff always changes. Just as I get to one person I really like, bingo, everything has changed. That person left and I got to start all over. Recognition of PTSD. We can't fix what we don't recognize. First is there's a failure to recognize the symptoms. Duh, why would that be? And the reality is, I talked to many veterans who said, "My wife said I was doing this, that, or the other," and they weren't even aware of it. And so they don't even recognize that anything is wrong. The second thing is, you've heard I'm an addictionist, the story of the old drunk who's wandering around the lighted parking lot and somebody says, "What are you doing, dude?" And he says, "I'm looking for my keys." And the other guy said, "Well, where did you lose them?" He said, "About 2 blocks down that way." And the guy says, "And what the hell are you doing looking for them here?" And he said, "The light's better here." So what often happens is patients and their family members incorrectly ascribe the cause. The cause is, I went to war. That's what happens when you go to war. That's what happens, and that's what I'm like now. It's the way I was trained when I was in basic training. There's a stigma surrounding PTSD. If you're in the military, you anticipate negative effects on your career. Now, that's not supposed to happen, I know, but trust me, it does interfere. It interferes with security clearances, it interferes with promotion, and many people who are active duty will go to civilian doctors because they don't want to report it to their primary care physicians. And then there are a lot of myths and misconceptions. What are some of those? PTSD is only a soldier's problem. It's only a man's problem. In fact, men behaving badly. It's a psychiatric condition denoting cowardice or craziness or weakness. It's an all or none phenomenon. It only affects those in direct combat, and conversely, everybody who goes off to war comes back with PTSD. Here are the facts. It doesn't just occur in soldiers. We know that PTSD is PTSD. It occurs in response to a traumatic event, and that traumatic event could be a fire, flood, shooting, assault, rape, incest, whatever. And it does occur in the civilian community. We're going to talk more about military. It's not just a man's problem. In today's Army, it's a problem of men and women. I won't discuss the whole problem of sexual assault in the military, but tragically that occurs and causes PTSD as well. It's not all or none. It's not like pregnancy. It either is or it isn't. There's mild PTSD, moderate, severe, and very severe, and not everybody has the very severe case. It's not just those in direct combat cooks these days tell me, I'm a cook. I had an IED come over the wall and land not more than 50 yards from where I was cooking, and it killed 4 people. I had another soldier tell me I was running track in the green zone, the safety zone, and here comes a mortar and blows up, and people can be hurt, not just in direct combat. And there are other things as well. Guys that walk into airplane blades or jet exhaust on an aircraft carrier, or people that are in fires on board or elsewhere. And not all combatants get it. Again, 1 out of 5 according to the estimates now, but that's still a very large number. It's affected by the social milieu and the support network. My first official duty in the Army was to go to the American Psychiatric Association, which that year was in San Francisco. I walked out of my hotel with my Army uniform on, and people spit on me and cursed me and called me baby killer. I had never been to Vietnam. But I imagine what must it have been like to come home to a country that treated you that way. Fortunately, we learned that lesson. So for Iraq and Afghanistan victims, at least at the beginning, we treated them differently and we thanked them for their service and so forth. And now it's becoming kind of old hat, and so people aren't doing that much anymore. But that social milieu matters. In Israel, where there's danger very frequently, the social milieu is very supportive. And there appears to be less severe PTSD. And most vets you find don't talk to anybody about their condition. They keep it all inside. In fact, they hide their awards, the Vietnam vets, in a little shoebox, generally at the top of their closet, never to be seen again. And it's not just a psychiatric disorder, rather it is a psycho-neuroendocrine/immunologic disorder. And by the way, I put the dots before the disorder because, as you know, there's a lot of controversy these days in the last 2 or 3 months about what do we call this? Do we call it post-traumatic stress injury? Do we call it post-traumatic stress condition? Do we call it just post-traumatic stress? Because the disorder part seems to imply only psychiatric problems. I don't think it matters what we call it. It matters that we recognize it and treat it. An involvement in spiritual pursuits, getting involved in something bigger than yourself, with or without going to formal religious studies. And many vets with PTSD avoid church like the plague. They say things like, how can there be a God that let happen what I saw and experienced? How can God love me after what I did to that 8-year-old kid or that soldier I sent away? Getting back into spiritual pursuits, something bigger than yourself, with or without religion, is important. Viewing your issues in a new light. Veterans in recovery can learn to see their triggers as manageable events. An Iraqi vet said, I'm the luckiest son of a gun alive. What happened? Well, I was driving down Loop 410 the other day. The air conditioner was on, radio was on. I was minding my own business. All of a sudden, out of the corner of my eye, I see this broken down jalopy on the side of the road. And I hit the wheel so hard, that I went 4 lanes over. Had there been anybody in those lanes, I could have been killed. Why? Because in Iraq, a broken down jalopy can be loaded with explosives. A piece of trash on the road can be something you want to avoid. Dealing with the need for highs. When you do away with all the dopamine in your brain, you feel blah and numb all the time. And so you look for highs, whether it's substance abuse or riding motorcycles too fast or gambling too much or bungee jumping, whatever it is. Developing comfort with usual life activities, reconnecting with family, including interactions, intimacy, and your kids. Kids don't understand. Why doesn't Dad come to any of my games? Because Dad can't stand to be around a lot of people. It has nothing to do with you. But kids don't get that, and kids think Dad doesn't care. Mom doesn't care. Why wouldn't they go if they cared? And then redefining your life after PTSD, post-traumatic growth. Recognizing how do others who get past it do so? Learning what you are is not what you did or do. Tragedies happen in war. That's just war. It doesn't mean you're a bad person or a psychopath just because tragedies happened in war. Learning and growing throughout your life. Trying to find meaning for your life and making each day count. In terms of co-occurring disorders, very briefly, it's important to treat both disorders. So if somebody has a substance abuse problem and PTSD, and they only get treatment for one, chances are the other one will flare up and their recovery will not be very good. So you need to treat both disorders and treat both to remission. There are, fortunately now, dual diagnosis treatment programs where both can be treated. There's a need for support and sobriety and going one day at a time. Medications for sobriety probably pay a back seat, but may be helpful. Suicide, tragic problem these days. The risk factors are a person sees no way out and fears things will get worse. The predominant emotions are hopelessness and helplessness. The person is anxious, agitated, and has insomnia. Thinking is very constricted with a tendency to see things as all black, all white. It's all good, it's all bad, and it's mostly bad. And the judgment is impaired by the use of alcohol and drugs. And weapons is a big deal. Most of us don't know how to use a gun. Trust me, soldiers know very well how to use a gun. Suicide prevention, ask about it if you see these kind of events. Don't be afraid to ask. And then throughout treatment, ask again, because it may not be there this time, may be there next time. If you can involve the support system, stop the abusive substances. Alcohol and drugs are a deadly combination when it comes to suicide. Remove weapons if you can. And suggest the VA hotline. I've given you the number, by the way. And then refer if you feel uncomfortable, if you feel that they may be at risk for suicide, and document in your records very well. These are the information sources. Our book, our website is free. The book is not free, but the website is mybacktothewall.com. And if you go to the forms section, the PTSD checklist and screening list is there. You're free to download them. They're in the public domain. They come from the VA website. The VA has a wonderful website, ptsd.va.gov. These are in your handout. The NIMH, National Institute of Mental Health, has a great website. Mayo Clinic has a good one, My Back to the Wall. And then I'm the medical director of a website called healthyplace.com, the world's largest consumer-driven website. Finally, for 20 years you heard I was on TV. I had a piece called The Mind is Powerful Medicine. I never realized how powerful TV doctors were until I had a patient come in with obsessive-compulsive disorder, a female lawyer, actually. And I said, you know, this disease, OCD, you need both therapy and medicine. She was cool with the therapy, no medicine. Back in those days, psychiatrists really did therapy. And she came in week after week, and I said, you know, you really would do better if you did the medicine and the therapy. She said, no medicine, okay with therapy. One day she comes in, she says, okay, take the medicine, I'll take it. I said, well, great, what made you decide to do it? She said, well, I was cooking dinner the other night, and I had the TV news on, and there was this doctor on the news that talked about this disease you say I have, OCD, and the doctor on TV said, to get better, you need both therapy and medicines. I'll take the medicine. The doctor was me. She didn't recognize my voice. She was in the other room. And that's when I realized, hell, on TV she'd listen to me. In person, maybe she wouldn't. And one of the benefits of being on TV was I did series. And one of the series we did was on teen suicide. And as a result of that, I got to give a lecture in Corpus Christi, Texas. And I lectured, and when it was over, there were 20, 30 people waiting to talk to me individually, privately. And I noticed out of the corner of my eye, there was one lady who kept waiting. She waited till all 20 or 30 were gone. And then she came up to me and she said, Dr. Croft, I don't have a teenage kid. And I didn't come to listen to your lecture. It was pretty good, by the way. She said, I came to thank you. And I said, thank me for what? She said, you did a series on TV that was on down here on the news, and it was on substance abuse and PTSD. And my father, who's a Vietnam vet, watched that. He was in a bad way. And as a result of that, he said, you know what? I'm going to go get treatment. He went to a VA treatment facility, and now he's doing so much better, and I just wanted to thank you. And I thanked her. About a couple of months later, I got an email from her that her father had been diagnosed with cancer, lung cancer. Agent Orange in Vietnam caused lung cancer. He had been diagnosed with it. And I called him. I asked her, could I call him? And I called him, and I congratulated him on his sobriety, and he thanked me. And I said, I understand you're a hell of a fisherman. I said, you know, we have a little place down there, and we like to go fishing, but we don't do very good. You got any secret fishing spots? And he said, yeah, I do. But, Doc, there's some things we don't tell anybody, even though we're grateful for what you did. About 9 months after that, I got this email. And this is what I'd like to share with you. Dear Dr. Croft, I'm writing to let you know that Dad passed away a couple of weeks ago. Before his death, he asked if we would contact you and convey his thanks for a great year of sobriety and improvement from his PTSD, resulting in better mood and attitude, the initiation of which he credits to you. Life after treatment, he said, gave him back his self-esteem, his dignity, as well as his ability to enjoy life and his family in a meaningful way. He even got his medals out from his secret locked hiding place at the bottom of his closet and proudly showed them and explained them to us. He told us about his war experiences. He began to wear his Vietnam vet cap and to do volunteer work with other vets. He gave up his guilt and his anger and his rage, and he once again became proud to be a veteran. Most of all, he became a real father and grandfather again, and appropriately laughed and cried and loved and started to appreciate life in us. He wanted you to have this, his secret fishing hole map. He thinks a few big ones are still left there. With persistence and good luck and good technique, he knows you'll enjoy it as much as he did. He said it was the least he could do to repay you for starting him on the road to the most wonderful and meaningful year of his life. And we as family want to thank you for an unbelievable year of positive memories of our real dad that will live on in our hearts and minds forever. God bless our father. God bless you. And God bless America. Thank you very much for listening.